Hi and welcome to this Wound Hygiene Bite-Sized podcast. My name's Shelley Hawkins, Strategic Customer Engagement Manager at Convatec. For this bite-sized series, we'll be introducing you to Wound Hygiene, a 4-step protocol of care that anyone can do. Today, I'm joined by Anita Charters. Anita, can you introduce yourself, please?
Yeah, I'm Anita Charters, a tissue viability specialist nurse in Birmingham.
Thanks, Anita. Thank you so much for being here today. So can you tell us today about the team that you work in your area and how you first heard about wound hygiene?
Yep, so the team I work in, massive area in Birmingham, very diverse cultures and patients. So implementing wound hygiene was a challenge, but we overcome challenges in Birmingham. But yeah, it's gone really well so far. And the team have grasped the wound hygiene challenge by the horns, and we're really excited about the results we've been seeing.
So how was that received in your area, and how did you manage the rollout in such a complex environment?
It was received, at the start, it was quite complex. So we started with one district nursing team and just sort of slowly approached it, got really good results with that, ended up, highlighting how good the results were from the wound hygiene champion in the team. And from there, we then approached the localities. So we started in the north of Birmingham and then slowly made our way over to the east, and now we're in the south. So we're slowly making our way through Birmingham, but everything has sort of run smoothly and it's been well received by everyone, really. So yeah, really exciting.
Tell me about that wound hygiene champion role. Do you have that in each one of your bases?
Yeah, we do. So when we go to our lunch meeting with Convatec and myself and another tissue viability nurse in our team, we highlight a couple of people in the team. So normally they don't put their hands up, but someone will get nominated to do it. And yeah, they channel the wound hygiene through the 4 weeks, and they're the sort of go-to person. So when Convatec go to the team, they're the ones who will sit there and say, I've been leading it and these are the results, and come back next week and I'll be here again. So yeah, every single team has one or two. So yeah.
I think that's a really, really innovative way to roll it out, and also champion someone within the team and give them a development opportunity.
Yeah, absolutely. And I think it's a really good thing that the tissue viability nurse is there as well, because it's not just showing the company and it's a product, it's showing that this is a challenge, it's wound hygiene, and the tissue viability nurses are on board with it as well. So yeah, it's gone really well, and the wound hygiene champions, if they have anything that they want to discuss, they would normally come to me or whoever the wound hygiene tissue viability nurse is in the locality. So yeah.
And what kind of results have you seen? Can you share any amazing stories that you've got?
So personally, I've had a lady come into the clinic who had a non-healing wound. She had it for 12 months. It was a leg ulcer. There was definite biofilm there. And I thought the only way that we're going to heal this is with some compression and an antibiofilm product. So initial assessment, we put her in compression, but I chose Aquacel IG Plus Extra as the primary for the antibiofilm and the antimicrobial stewardship as well. And the results have been phenomenal. It's been a proud piece of work that I've done from the clinics that we've ran, and the patient has expressed her gratitude. She's still with us in the clinic and she's slowly healing. But yeah, we're still using the Aquacel IG Plus Extra, and we've used it for over 2 weeks because we've sort of clearly seen that the biofilm is still there in the wound.
Yeah.
So yeah, just to highlight that Aquacel IG Plus Extra has been used throughout, and she's healing really nicely, and the results have been amazing.
So you've been following that 2 weeks, reassess, and then if the wound is improving and responding to Aquacel IG Plus Extra, you're continuing the use. Yeah,
absolutely. And I think every 2 weeks we've sort of noticed, it might be a bit sort of stagnant, but the Aquacel IG Plus Extra has definitely worked. It's de-sloughed the wound bed, it's made it a lot cleaner, it's reduced in size with the compression, but continually we've used the Aquacel IG Plus Extra, and I think when it gets to a point where we notice real improvements, then we'll step it down to Aquacel Extra. But yeah, we've had really good results, so really excited.
And how are you selecting your patients that should receive wound hygiene?
I think mostly for me, definitely when I'm out in the community and in the leg ulcer clinics, they're already non-healing. They've already reached that stage where they've had this wound for longer than 2 weeks. Some are 6 to 12 months old, so they're really complex. So we've already noticed that they're in that hard to heal phase, and we need to try and get them out of it. So as soon as I notice that the wound's been there for a while, it's straight to Aquacel AG plus extra to try, because we know the biofilm's there.
Yeah.
So it's to try and get the biofilm to break down into the wound, and then obviously the wound hygiene around that as well. So yeah, we've been using the 4 steps, so cleanse, debride, refashion and dress. And on the 4th, the dress part, we've been using the Aquacel AG plus extra. We know the science behind it, and we know that it works and it breaks down the biofilm. So that's been my go-to product for the patients that I've seen. Yeah.
That's fantastic. So what advice would you give to any nurses who are looking to implement wound hygiene?
Go for it. I can't say anything negative about it. It's showcased amazing results in Birmingham, and we continue to showcase the amazing work that we've all done. And, you know, we've managed to get over 60 case studies just from the 2 localities. And all the results have been really promising. Patients have healed after having wounds for a long time. So, you know, the results speak for themselves. So if the nurses just take the time, if they do the 4 steps of wound hygiene, it's a better outcome for them and a better outcome for the patient as well.
Fantastic. Thank you, Anita.
Thank you.
Please join us for the next episode, when we'll be joined by another tissue viability nurse sharing her stories about wound hygiene.